So I'm again telling the task is that Ronnie, he is 8-year-old boy. He is already diagnosed case of hereditary spherocytosis. He now needs frequent blood transfusions. And the mother Mira want a solution for that reasons. And the consultant has taken about the splenectomy. So I have to take the permission from you, convince you for splenectomy. So I start.
Yes, please.
Okay. So hello, good morning.
Good morning.
I'm Dr. Sultana, one of the children doctor in this hospital. I believe I'm talking with Madam Mira, mother of Ronnie.
Yeah, Mira. Yes, doctor, I'm Mira.
Nice to meet you, and thank you very much for coming here. It's really an honor to sit a mom like you. You are really caring Ronnie nicely.
Oh, thank you.
Okay. Okay. So, ma'am, today I'm here to talk about a new management plan about Ronnie's management purpose. Is that a perfect time for you?
Oh, yeah, yeah. What's the new plan for my child?
That is, we are going splenectomy. But before starting the conversations, do you want anyone join this meeting, or shall we start?
Yeah, yeah. Please, you can start.
Okay. So, ma'am, can you tell me what is your update about Ronnie's health?
Recently I've noticed Ronnie needs lots and lots of transfusions, maybe more than 6 or 7 times in a month. That is really frustrating for us. Yeah, but I'm really willing to listen the new plan for the Ronnie.
Yeah. So, for that reason, it's really a travel, frequent blood transfusion needed. For that reason, our consultant taking a decision for new management plan, that is splenectomy. Have you any idea about this splenectomy?
Well, I heard about the spleen, but I haven't heard about splenectomy. What is that?
Okay, ma'am, I'm here to answering all your questions. First of all, I want to tell you the spleen is an organ that is present on our tummy, left side. I'm showing you the side. And what happened? The function of the spleen is it distract the abnormal cells in our body. And you know, Ronnie is diagnosed case of hereditary spherocytosis. And in hereditary spherocytosis, there is abnormal shape of the blood cells present. And now it is greatly distracted by the spleen. So if we splenectomy done under operations, then the destruction of the blood cell will be reduced, and also the blood transfusion will be less required. Am I clear so far, ma'am?
Yeah, it's quite clear, but I think Ronnie is really, 8 years, very young. Is this a major operation or minor one?
Yeah, ma'am, I completely understand your worry. You're really a keen mother. And to tell you that we will done it by the surgery. The surgeon will be discuss how can he done this. Really, the expert team will involve, and also it can be done by open or keyhole surgery. Best answer can give by the surgeon. Am I clear, ma'am?
Yeah, but apart from this, is there any others advanced medical treatments? Because surgery is definitely not my options for my baby.
Yeah, yeah, I understand, ma'am. Completely understand you. Yeah, the alternatives is that the blood transfusion, but now recently it really the frequency of blood transfusion increases. That's why this is the solution, and this is best for Ronnie to do the splenectomy. Uh, okay, is that
But
understandable?
well, yeah, it is understandable. But what happen if I do not let Ronnie do this surgery? What will happen to my baby?
First of all, you know, Ronnie needs frequent blood transfusion, which is a trouble for you. Another one thing is that the spleen will be get enlarged, and there is large volume of now blood cell are distracted. So, if enlarged spleen, it can be when Ronnie play or anytime any trauma, it can be obstruct, it can be injured occur. So, better decision the splenectomy.
And after the splenectomy, is there any complications can happen? For example, you mentioned the spleen is important to destroy abnormal cells. So if that organ does not have, what happened to my child afterwards?
Yeah, ma'am, I understand. Actually, I have to tell you that spleen is an organ that is very much important role in our defensive and immunity control, immunofunctions, but it will be decreased. But for that reason, we'll take lots of steps. Before surgery, we are giving to some shots 2 weeks before, and we are giving him lifelong antibiotics, antibiotics. We are giving him bracelet. these are, and he has to avoid infections, try to avoid infections. Also, about the drawback of the splenectomy, I want to tell you that, any procedure has some drawbacks like bleeding, pain, but as our expert team is doing that, so they will do it within hygienic environment. So the bug, the catching bug will be reduced, and also for pain they will give painkiller. That is okay, ma'am. Am I making myself clear?
Yeah, it's very clear, doctor. Thank you so much. But can you give me a time to discuss this with my partner?
Yeah, ma'am. It is not emergency, urgent. You just discuss with your partner and take time and give us the final decisions. Okay, ma'am.
Okay, all right. Yes, doctor. Thank you.
Okay. So, do you have any other concern, Mira?
No, if I have a concerns, I will come and talk to you again. All right.
Okay. So, ma'am, I have discussed today lots with you. Should I summarize what we discussed for better outcome?
Yes, doctor.
Uh, so first of all, I want to tell about the new plan about Ronnie's management, that is splenectomy. I am here to take your consent about this matter, and I already told you the procedure of splenectomy, the function of the spleen, and the benefit, the risk, everything I have discussed you, and what are the preventive measure we are taking for yeah, after splenectomy to prevent this loss. Okay.
Okay.
And ma'am, I'm giving you some trusted websites and leaflets about this matter, and then it will be much more clear. And I also add a group and splenectomy done in this group. Then you will get much more information in this matter. How does that sound?
That's perfect, doctor. Thank you.
Okay. So, ma'am, thank you very much for your time. And if you have any further questions, we'll be here to answer you. And we are waiting for your response as soon as possible.
All right. I will probably have a discussion tonight with my partner and I will tell you about our decisions.
Okay. I also want to share one information, ma'am, that after splenectomy, he will need to stay 1 month at home, and he need to avoid sports for 3 months. Okay.
Okay. All right.
And
Thank you.
for that reason, purpose, if needed to liaise with the school, we will contact with school.
Okay, doctor. All right.
Okay. Thank you very much for your time. So this is
Thank
all
you.
about splenectomy counseling.
Mm, perfect.
Using from